I think a couple things. One is that there is this misconception that girls cannot have ADHD. It is a boy thing, it is a kid thing, and it only exists in males. And I think there's some reasons for that misconception, which we can talk about. But I guess to start to sort of just make sure it's really clear is this is not the case. Girls and women can absolutely have ADHD. It can look different in girls and women, and I think that's part of what makes it challenging to identify it in girls and to get them properly diagnosed and treated. In girls, what we often see is more of that inattentive subtype, so more of the challenges with staying focused or often getting easily distracted or having trouble organizing. And these things are just typically harder to measure and to recognize. They don't stand out in that same way that the hyperactive impulsive behavior tends to stand out. And that hyperactive impulsive behavior is often what we see more in boys. And so those are the kinds of behaviors that are getting the attention and getting the referrals, and those kids are more likely to get diagnosed sooner than the kids and the girls who have that inattentive subtype that kind of flies more under the radar. And so I also just want to make the point that the girls can absolutely have that hyperactive impulsive type too. They can have that combined condition where they have difficulties in both. But because they seem to have more of that inattentive presentation, they often are